Hello everyone, this is Shreyasi Singh. I'm studying in second year BDS in Vadodara, Gujarat, and I have a keen interest in making such educational videos, and I love to learn about new topics and to explore them. And with this interest only, I have started this channel, The Excelling Medico, and I would be posting such videos if at all this video gets any good response or views, likes or shares, then I would love to take this thing forward and to record many more video lectures for my juniors or my seniors who are a bit interested in such pharmacological topics or any topics related to medicine or related to dentistry. So here I begin with my first ever video, that is on the topic on a pharmacology and subject pharmacology, and the topic Parkinsonism. So basically, Parkinsonism is a chronic progressive neurodegenerative disorder. So what do we mean by this? So it is a chronic condition which progresses with time, and it is a neurodegenerative disorder. So it gradually degenerates the motor neurons, and it is responsible for causing Parkinsonism, and it is characterized by, so the characterization of the person suffering with Parkinsonism is rigidity, that is limited movement, tremors, that is shaking of hands, legs, face, that is basically the involuntary movement caused in our body. And thirdly, it is bradykinesia, that is regarded as slowness of the movement. Any slowness in the movement is regarded as bradykinesia, and it is very frequently seen in the patients of Parkinsonism. Other symptoms include excessive salivation. That particular person who is suffering from this disease will very frequently experience this excessive salivation. Secondly, other symptoms include abnormalities of posture and gait. Gait means the pattern of walking. So they'll prefer, or rather not prefer, they'll suffer from such a disease. As they are suffering from such a disease, the gait or the walking pattern of that person would be somewhat different as expected from a normal individual. So it would be a bit different. And thirdly, it includes seborrhea. Seborrhea, it basically means excessive discharge of sebum from our sebaceous glands. The sebaceous glands present in our body, when they are responsible for causing excessive discharge of sebum, then that particular condition is known as seborrhea. And lastly, the mood swings. This phenomena or this disease was first described by, it was for the first ever time it was described, or we can say in our basic language or layman's language, that it was discovered by James Parkinson in the year 1817. Though the year is not important for our exams or any theory exams, but still. So James Parkinson sir was the first one to describe this phenomena, and he described it as with respect to the origin of its occurrence. So on the basis of that, he classified it into two types. That is, mostly the cases are idiopathic or they are drug-induced Parkinsonism. The person is either suffering from drug-induced Parkinsonism, or it may be an idiopathic condition. So in case of idiopathic condition, so what does idiopathic actually mean? So it is any disease that is arising spontaneously, and its cause remains unknown. That is, we don't know its cause. Its root cause is unknown to us, and it is arising spontaneously. So that kind of condition is known as idiopathic condition. And then in case of Parkinsonism, here degeneration of nigrostriatal neurons is taking place. They are generally nigrostriatal neurons. They are generally they are forming the bilateral pathway for dopamine transfer or dopaminergic pathway. It is a bilateral pathway. It contributes to this dopaminergic pathway. So it results in dopamine deficiency. So when in this disease, in idiopathic condition of Parkinsonism, as the pathway is getting degenerated, so it results in dopamine deficiency. So basically what is happening over here is there is a disturbance between inhibitory dopaminergic neurons and excitatory cholinergic neurons. So basically we have a balance in our body, in our neural system, of inhibitory dopaminergic neurons and excitatory cholinergic neurons. But in case of Parkinsonism, and generally which is caused by idiopathic conditions, so in that case, the balance between the two is disrupted or it is disturbed. So generally in this condition, anti-Parkinsonian drugs are given which can elevate the symptoms, and two basic strategies of symptoms include, the drugs which are given, the anti-Parkinsonian drugs which are given, they are given on the basis of two strategies or for the treatment which has to be provided. So the first strategy is enhancing the dopaminergic activity, and the second is depressing the cholinergic activity. Now, as we have read about the strategies of treatment which are being provided with the help of anti-Parkinsonian drugs, now we would be learning a bit about anti-Parkinsonian drugs. So anti-Parkinsonian drugs are basically that class of drugs which are used for elevating the Parkinsonian symptoms or elevating them basically. So classification of anti-Parkinsonian drugs include drugs that increase the dopaminergic levels, that is first classification, and second classification is drugs that influence cholinergic system. So anti-Parkinsonian drugs act in two ways, or they may be said to be classified into two different types. That is, firstly, drugs that increase dopamine levels, and secondly, drugs that influence cholinergic system. That is, for maintaining the balance between the two, this type of classification has been made. So drugs that increase dopamine levels include, so under this category, we have further classifications. That first is DA precursor or dopamine precursor, which includes levodopa. Secondly, it includes drugs which release dopamine. So drugs which are responsible for releasing dopamine in our body, that is amantadine. Now, third is dopamine receptor agonists. So dopamine receptor agonists include bromocriptine and pramipexole and ropinirole. Now, final subclass of the drugs which increase dopamine levels is drugs that inhibit dopamine metabolism. So, for inhibiting dopamine metabolism, the drugs which are required may be classified into two types. First is MAO receptors or monoamine oxidase inhibitors, MAO inhibitors, and secondly it is COMT inhibitors, that is catechol-O-methyl transferase. So under MAO inhibitors, we'll study about selegiline and rasagiline. These are MAO inhibitors which inhibit dopaminergic or dopamine metabolism in our body. And in COMT inhibitors or catechol-O-methyl transferase inhibitors, we'll talk about tolcapone and entacapone. Now, the second classification of anti-Parkinsonian drugs is cholinergic system, the drugs which are influencing the cholinergic system. So, these include central anticholinergics and antihistamines. So, central anticholinergic drugs include piperidine, benzhexol, and benztropine. And antihistamines include orphanedrine and promethazine. So in this video, we have learned about what is Parkinsonism, its classification, its origin of occurrence, and the drugs which are used, the basic properties or the basic classification of the drugs which we use in treating the patients which are suffering from this disease. So in the coming videos, I'll be coming up with the second part, that is the detailed classification of drugs which we use to elevate this condition or the symptoms of this condition. So stay tuned for the next videos, and thank you so much for watching it till here. Thank you.